Hello everyone, this is Dhaval Desai, founder of Arihant Healthcare Technology. Today I am recording this video to provide a brief introduction about 21st Century Cures Act, information blocking, excep- exceptions involved in the Cures Act or the information blocking, role of interoperability, helping the information blocking, real life use cases, and what we do as part of Arihant Healthcare Technology. So let's get started. Before we jump into the Cures Act, I just want to briefly introduce my organization. We are the leading healthcare IT consulting firm specialized in healthcare interoperability, data exchange, data solution mapping, and custom healthcare IT solution. I have more than 16 years of experience in health IT industry, experience working with cloud technology, interoperability engines, built many successful applications for healthcare industry, and we help startups, small size and mid size organization to build their solution, cloud native solutions. In this session, we will look into US healthcare spendings and waste, HHS and ONC, history of the Cures Act and the exceptions involved for the Cures Act, interoperability, role of API, and what we do in Arihant Healthcare Technology as part of interoperability. Before we jump into the Cures Act and the history of the Cures Act, let's just review research data which shows the total healthcare spendings. United healthcare spendings, according to 2023 July, it's 12,555 per capita, which is way above than the average spending over the world is 6,414. It's almost twice of the average. If we see the administrative cost in the US per capita is 1055 as compared to average across the world it's only 194, so it's almost 5 times more than the average cost. If we consider the US healthcare waste or the wasteful healthcare spending in the United States, it's reached almost 935 billion, which is, if you see over here, this data according to April 2023, divided into different types of waste: administrative waste, inefficient spendings, operational waste, fraud and abuse, low value care, pricing failure, etc. Let's consider what is the role of HHS and ONC. So HHS, we all aware US Department of Health and Human Services, or also called as HHS. Its main responsibilities are health and well-being, programs and services basically related to human health, health equity, participates in health equity, doing research and science related to human health, public health preparedness, health IT and interoperability, and global health leadership. I'll focus more on ONC. ONC is a part of HHS. So basically, ONC is an entity within the HHS, and it was mainly established or lead to coordinate the nationwide effort for healthcare IT. And that's our main focus today. Uh, so the ONC established in 2004, but it actually legislatively mandated as part of High Tech Act in 2009. So, what is the role of ONC? There are multiple roles of ONC. Coordination is, let's start with the coordination. So, ONC basically serves as a principal federal entity responsible for coordinating the efforts to implement and utilize advanced health information technology. So, what's that mean? It basically collaborates with various stakeholders, healthcare providers, vendors, researchers, and policymakers. Health IT adoption. Another role of ONC is a health IT adoption. It basically promotes the adoption of the health IT systems. Example, electronic health record across the healthcare ecosystem. The main purpose of health IT adoption is basically is to encourage the meaningful use of health IT and improves the care quality, population health, and cost efficiency. Data exchange. Data exchange, ONC focuses on establishing a standard based health information exchange. This facilitates seamless sharing of patient data among the different healthcare entities, leading the better information decision making. Inspiring confidence. ONC inspires the confidence and trust between the healthcare systems by ensuring the privacy, security, and interoperability. It, it works to enhance the data privacy protection and cybersecurity measures. Empowering individuals. ONC empowers the individual by promoting their access to health IT tools. Patient can use these tools to manage their health, access their health records, and engage in the self-service, basically patient portal, electronic health record, those kind of tools, or probably nowadays you can consider telehealth. So let's look into the history of Cures Act, how it started. ONC ONC provided a definition of information blocking, an analysis of the extent to which the process exists in the industry, and the recommendation of to address these issues for the information blocking. It proposed in 2015, December 7, 2016, 21st Century Cures Act was actually signed by the government, and it includes the definition for the information blocking and provision to address the information blocking. So, what is the information blocking? Let's consider the definition. So, it's basically a practice by the healthcare provider, health information exchange, health information network, or health IT developers. Health IT developer here will see into more details. Who are the health IT developers? Except as required by law or specified by secretary as a reasonable and necessary activity, is likely to interfere with, prevent, or materially discourage access, exchange, or use of electronic health information. How do you detect the information blocking? So, something involves with electronic health information, practice which is likely interfering, preventing, or materially discouraging the access, re- requisite knowledge by the actor, or not required by the law, not covered by an exceptions. The exceptions we will see further into future slides. For the information blocking, the penalties are up to $1 million. Information Blocking Act, or 21st Century Cures Act, was proposed under Section 444 45 CFR. That defines, like, authorize the secretary to identify the rule through a rule-making reasonable necessity activities that do not constitute information blocking. It also empowers the HHS Office of Inspector General to investigate the claims of information blocking and provides the referral process to facilitate coordination with HHS and of OCR, Office of Civil Rights. It also prescribes the penalties of the information blocking, charges the ONC with implementing the complaint process of reporting of information blocking, provides the confidentiality protection information. So, if you would like to learn more about this section, you can go on the healthit.gov, or you can also learn search for the Cures Act, information blocking section 4004. You can learn more details about this act. So, what mainly Cures Act focuses on? It mainly focuses on interoperability, requires the EHR to be interoperable, breaks down the information blocking, mandates the API to build an API to healthcare system, and promotes the data exchange. The actors involved. So, when this rule formed, there are to cover all the actors in the healthcare. So these are the four actors involved: healthcare providers, health information networks, health information exchanges, and health IT developers. So who are the healthcare providers? So anyone in healthcare industry who are professional licensed care provider who is involved in the care, healthcare diagnosis and treatment services. It is an individual, health professional, or health facility organization licensed to provide healthcare diagnosis and treatment services, including medication, surgery, medical devices. They are persons or entity that provide a medical care or treatment. Healthcare provider includes doctors, nurse practitioners, midwives, radiologists, labs, hospitals, urgent cares, etc. Non-physician example for the healthcare providers are obviously physical therapist, home care, home health provider, durable medical equipment companies, pharmacies, laboratories, etc. Health IT developers. As I mentioned earlier, health IT developers are not the actual person. It is basically an entity, an individual, or the entity that develop or offer the health information technology, and which had at the time it engages in a practice that is subject of the information blocking claim. Health IT certified under the program. So it's basically any individual or entity who are involved in the information blocking during the claim occurs. HIN and HIE are very closely related. It's basically health information network and health information exchanges. The entity or the individual that satisfies, or basically there are two things which comes under this, determines, oversees, administrates, controls, and substantially influences policies of the agreement, that defines business, operational, technical, or other conditions or requirement for enabling or facilitating access, exchange, or use of EHI between the or among two or more unaffiliated individuals or entities. I know it looks complex, but it is not. It is basically a network or the entity which determines, oversees, or administers, controls, influence the policy and agreement, the agreement which defines the business operation and technical and other conditions and requirement for enabling or facilitating the access or exchange or use of EHI between or among unaffiliated individuals. That's the main thing. Provide and manages, controls, or substantially influence any technology or services that enables the facilitated access, exchange, or use of EHI between, among, or two or more unaffiliated individuals or entities. Examples are nationwide health information networks, health information exchanges, electronic health record vendors, healthcare providers, healthcare insurance companies. QHIN is one of the examples for health information network. So that's about information blocking. And the main thing why we are promoting the information blocking, it's basically we are promoting the data exchange, the rule that aims to promote open exchange of the health information between providers, payers, and patients. That's the main goal of it. I already covered the definition. The penalties of these violation may face the civil monetary penalties up to $1 million. Exceptions are, there are some privacy, security, infeasibility, and health IT performance exceptions, and we'll see those exceptions in few further slides. The end goal is mainly about all these or about ONC is improving care by increasing data exchange, and rule seeks to improve the quality of care and reduce the cost. So the exception for these rules are divided into three categories: EHR Developer Certification Program, promoting patient safety, and preventing harm. So how actually we are promoting patient safety, preventing harm for through this exception? Let's look into more details. So the exceptions are again divided into eight categories or eight kind of exceptions. It explained under the 45 CFR 171 rule, where the we'll go through this exception one by one with example. Let's look into the preventing harm. So preventing harm is basically, let's consider a scenario: a healthcare provider receives a request for a patient's sensitive mental health information, and the provider denies the access due to the concern about the potential harm patient can cause to himself. So that, in that condition, if the provider does not share the information, it doesn't consider as an information blocking. Privacy exception. So in this one, the privacy request for, let's discuss all of them with example. Privacy exception. Let's consider a scenario where the patient requests the access for their own medical records, including detail about a recent HIV diagnosis, and provider hesitate to share that information without a proper consent. And that's what covers under the privacy exception. It's mainly focuses on the proper consent and whom the information to be shared with. Security exception. A health IT system temporarily restricts the access to patient data during the cybersecurity breach investigation. And in that case, if the information is not shared during those limited amount of time, it's okay. It comes under the information blocking exception. Infeasibility exception. Let's understand this with an example. It's basically a, let's consider a small rural clinic which they don't have enough technical facility to share the information with the hospitals from the city, and they just shows that they are ready to share the information, but they don't have a technical infrastructure to exchange information. In that case, that does not consider under the information blocking. They can still share the information through other media or other form. Health IT performance exceptions. An EHR vendor temporarily suspends the data exchange during the maintenance systems, and that usually happens in the IT infrastructure. A lot of EHR vendors goes through weekly or monthly service maintenance. Sometimes their systems are down, upgraded, patch upgrade, and in those cases, the information are not shared in a timely manner. But those are covered under exceptions the information can share back with the patient once the systems are back up. Content and manner exceptions, and this is more about how we present content or reports to the patient. So content and manner exception: consider a laboratory response to a request for a test result by providing a summary of the report rather than a complex raw data or laboratory Ionic codes, which I don't think so the patient will understand. Patient needs to know in the simple readable English format. So those kind of things are covers under content and manner exception. Fees exception: a health information exchange charges a nominal fee for accessing a patient record from multiple sources. That is covered under fees exception. Licensing exception is similar thing. A health IT vendor licenses its interoperability software to other organization for seamlessly exchanging the data. Let's look into the role of API to eliminate the information blocking. So API is nothing is also called as application programming interface. It's not only useful in the healthcare industry, but nowadays in all the IT industry or everywhere in the IT industry, API has been built. So API is nothing but application programming interface, allows two software system programs to communicate with each other. Is basically, or you would say, it allows the software system to expose the data in case of interoperability and data exchange, secure way to expose the data. Role of API in healthcare: API enables the easy exchange of the healthcare information. I would say any kind of information, API enables the easy exchange of digital data between the different healthcare systems like EHR labs, pharmacies. The example of EHI is FHIR API, allowed structured patient data, but it can be any kind of API, whether you have using a data analytics, data mapping algorithm. You can seamlessly create and deploy the APIs on the cloud, containerized it, scaled it. Benefits of APIs: basically use of APIs to improve the interoperability, data exchange, patient care, and reduce the cost. So, what is interoperability actually? The word looks fancy, but it is actually not. It's basically seamlessly connecting multiple systems. So, how? Let's look with the example. So, we have a different healthcare systems or hospitals, emergency room, medical centers, small clinics, urgent cares. Those are different healthcare systems, and uh, different healthcare apps, health related app, telehealth monitoring app, data analytics app. Before the actual Cures Act came, all these systems are connecting with each other and they are creating their own interfaces. I mean, there are no common way of connecting with these systems. And then what was happening? It's like all network mesh, duplication, redundancies. The updating the information at one place was not reflecting to other places, and it was like lag and a lot of errors. Manual intervention was required. And now with the interoperability, what we actually offer, basically what we actually do is we can create a seamless API, seamless interfaces. And that's what we do here basically as part of Arihant Healthcare Technology. We help clients to build their interfaces, to build their custom APIs, do their data mapping, clinical data. We understand the clinical data, whether it's putting the order to the labs or radiology systems, or exchanging the data between the different pharmaceutical systems, or just creating the APIs and securing your information on the cloud. So that's what we do here as part of Arihant Healthcare Technology. We can serve our different providers, vendors, healthcare application developers, or small startup companies, healthcare. Under the healthcare providers, we can serve as a health plan professionals, health insurance companies, healthcare clearing houses, home health agencies, whoever would like to build their IT systems, build their APIs, still within the HIPAA compliant. We help to build their and create their system. We work with healthcare vendors, whether it's a medical device company, RCM companies, EHR vendors, telehealth, telemedicine, population health, or laboratory information system, or research or clinical trial systems. These are the high level overview of our services. Healthcare interoperability, obviously, as I explained, it's basically we help to implement healthcare operability using HL7, Fire, R4, or using the different interoperability engines, which is Mirth Connect, Rhapsody, or some other engines. So, based on the customer needs or the amount of data they want to transfer, or their workload, we help you with build a clinical data mapping, data exchange. We help we provide a compliance guidelines, healthcare software development, cloud migration, and digital health strategy for startup. Startup usually struggles in the beginning to build healthcare software because of the compliance, regulations, security. So there are a lot of things needs to be taken care in the beginning. We help with that. And if anybody wants to know more details and would like to interest in our case studies, would like to discuss your problems, what are your scenarios for the interoperability or data exchange, please feel free to contact us.